care in hand. We're here to help, we understand. From home to healing, near or far, you're in great hands with Concierge Star. Concierge Star nursing care that shines so bright. Professional, compassionate day and through the night. Health, comfort, peace of mind. We're with you every day. Concierge Star nursing, your care, your way.
And welcome back to Concierge Star Conversations. I am your host, Marquetta Martin, and as always, I am joined by our founder and CEO, Concierge Star Nursing, Tamika Brown, RN.
Hey, everyone. Thank you so much for tuning in, and we're excited you're all here.
And I think today's episode is one that almost everyone can relate to because at some point, we've all had someone come home after surgery, was discharged from the hospital, or had a loved one only trying to recover at home.
Oh, sure. And honestly, that's where recovery really begins. People think once you're discharged, everything is over, but that's actually when families start asking the most questions.
So today we're talking about recovering at home and why having a plan can make all the difference. This brings us to our segment one. Hospitals doesn't mean fully recovered.
Right.
So Tamika, let's clear up one of the biggest misconceptions people have. When someone leaves the hospital, many people think, hmm, they're okay now. But is that really true?
No, not necessarily. Being discharged simply means your healthcare team believes you're medically stable enough to continue recovering outside of the hospital. It doesn't mean you're fully healed, and it doesn't mean you're back to normal, and recovery continues at home.
I never really thought of it like that. People hear the word discharge and automatically think everything's fine.
Exactly. Think about someone who has had knee replacement surgery or they're medically stable enough to leave the hospital, but they still may have pain, limited mobility, medication schedules, follow up appointments, exercising with the therapist, and now they're trying to manage all of that at home.
Yeah, so I guess it would be safe to say discharge is actually the beginning of another phase.
Exactly. I always tell people the hospital stabilizes you, but recovery happens at home. So I'm going to talk about a few of the things that's happening in the hospitals, like how quickly patients are being discharged today. You can go and have a baby today and they want to discharge you the next day. I know when I was having babies, it was like 4 days, 3, 4 days, you stay in the hospital automatically. I don't know about you.
Yeah, it was 5 for me.
For you, yeah.
They'll even discharge you the day later in the day.
Later in the day
after
after the person, right? It's just a trip. And why are hospitals these years different? I specifically think it's all politics. That's the reason why they're running differently. I think it's all about politics when it comes to that. Why families often feel overwhelmed when they're leaving the hospital. They're getting discharged too early is my theory. They're getting discharged too early. They're being sent home and the problems are still not fixed and they don't know what to do.
And if it's something new to the family and the patient,
right,
and they don't get full clarity,
you can feel overwhelmed, right?
Right.
Yeah. And why discharge education matters. Discharge education matters because it's your health. It's your recovery plan. You need that. You need to follow up with everything that's on your discharge plan. So everything that they're discharging you with, you need to know about it. So you want to educate yourself on it as much as you can and follow the instructions that they give you to follow for a better recovery. And a speedier recovery at the same time.
Absolutely. So that brings us to our second segment, the first 48 hours.
Right.
So let's say someone comes home from surgery today.
Mm-hmm.
Walk us through the first couple of days. What was the experience?
Okay, so the first 24, I'll say to 48 hours are extremely important. This is when patients are adjusting to their medications. They're trying to get comfortable at home. They're trying to learn how to manage their own pain now, learning how to move safely within the home, and following discharge instructions all in the same breath.
So people sometimes think, I feel okay today. This is like later on, maybe
Yeah.
a few days after
Yeah.
coming home from the hospital. So they overdo it.
Exactly. People start cleaning. They want to go and pay their bills. So there's no slowing down to actually heal.
And then they later wonder why they're exhausted or uncomfortable.
Right, right. Absolutely. So rest is a part of the treatment plan.
So I think the key word in all of that or phrase is slow down to actually is actually part of the healing process.
Right, right. Slowing down. Right. Absolutely. Rest is a part of the treatment plan, like I said. So you want to make sure you're hydrating yourself. You're getting the proper nutrition. You're walking safely within the home and you're not, bouncing around off things and re-injuring yourself. Following your medication schedules, keeping follow-up appointments that were scheduled to you before you left the hospital, accepting help, getting the proper sleep, pain management, those type of things.
Which brings us to segment 3.
Okay.
Common mistakes families make.
Oh, wow.
Now, Tamika, in your experience, what are some of these mistakes that you've seen families make?
I'd probably say trying to do everything alone.
And that would fall on who? The caregivers.
Caregivers, especially the caregivers, yes. Sometimes caregivers don't ask questions because they don't want to bother anybody. But healthcare providers would rather answer your questions than have something misunderstood.
Like medications.
Yeah, like medications. You can easily be confused about your medications. We are being polypharmed these days. You're getting too many medications. That's what we call it in the healthcare world, polypharming. Too many medications. So it's easy for an elder to get confused about what medication they're supposed to take in the morning time. In the afternoon, sometimes they have to duo on one medication. You have to double up, take one in the morning and the afternoon, and it gets confusing. So we're here for those type of things. Also, not reading discharge paperwork, skipping follow-up appointments, not drinking enough fluids when we talked about hydration, ignoring warning signs, trying to remove bandages without instructions, lifting too much, or it's something as simple as driving too soon.
Right. And think, this is, I'm laughing about it, but it's so true. Many people use Google to diagnose their symptoms as to what's wrong with them. And how do you feel about that?
Well, we've all done it. But every patient is different. That's why it's so important to follow your own healthcare team's instructions instead of comparing yourself to someone else's recovery.
That is very true.
Yeah.
So this brings us up to segment 4, which I think is very important.
Right.
Red flags.
Red flags. Let's talk about it.
What are those warning signs that people should look out for?
So I always tell people, know what your surgeon or your healthcare team told you to expect. And know when something changes. It's your body. Know when something happens. Discuss general examples like increasing redness with your doctor, drainage, if you see any drainage, persistent fever, difficulty breathing, any chest pain. Every chest pain is not what they call it, gas.
Right, exactly. Because they're quick to say, oh, I just got a little gas.
Right, everyone is not for that. It's chest pain can be just that, chest pain, and you need to get it checked out. Swelling that rapidly worsens, confusion, uncontrolled bleeding, severe pain that suddenly gets worse, and make sure you seek medical evaluation according to your provider's instructions or emergency services when appropriate.
And I think that's when families become nervous. They wonder, is this normal or should I call someone? I think it's best said, when in doubt.
Oh, yeah. When in doubt, call your healthcare provider.
Understood.
I can definitely agree with that.
Absolutely. Absolutely. So we're on segment 5, and we're going to ask, what does Concierge Star Nursing do? So let's talk about your company. Where does Concierge Star Nursing fit into all of this?
Well, our goal is to provide personalized nursing support that helps clients feel more confident during recovery. We know healthcare can feel overwhelming. We know this for sure. Sometimes people simply want someone to reinforce education, maybe answering nursing related questions within our scope, or help coordinate care or provide wellness support. And we provide all those things. We have services like RN wellness visits where we'll come out to your house and check on you. Virtual wellness, where if you can't leave your home, you can phone in and we'll do an over the phone checkup. Hospital follow ups. When you leave the hospital to home, we can follow you up on that. We'll follow you home from the hospital to make sure you're following everything that you need to follow. Medication education, care coordination, transportation. We're not currently taking wheelchair assisted transportation, but we do anyone that's ambulating and need assistance to get maybe to a doctor's appointment, a pharmacist, therapy or something of that nature. Senior wellness checkups, we do those as well. Recovery support. There's quite a few things that we offer at Concierge Star Nursing. You just have to phone in and let us know your situation.
Okay. So with this recovery support, let's talk in detail. What is it that does?
Well, recovery support is more so for cosmetic surgeries or any post-op surgery. You can go for a knee surgery, elbow, eye surgery, bellies, liposuctions, tummy tucks, mommy makeovers, whatever. We're there to assist in the post-op sector of it. When you come out of the hospital, if you need assistance getting a garment on or getting your medications down properly,
wound care,
we can assist with all of these things. So just depending on what you need for your situation, 9 times out of 10 we can cover it.
And I like the fact that you offer the transportation, so then this way you're getting that constant supervision
during your transport,
hospital to your location.
Yes, so anything goes wrong, you have a RN right there with you to adjust or make suggestions, recommendations, or get you to that ER where you need to be, or add in that care coordination and phone the surgeon and say, hey, this is what we got going on in the process of the transportation. Where do you want to do it now? What do you want to do now? You know what I mean? So yeah, it plays a big part.
Understood. So that brings us to our segment 6, which caregivers, they burn out.
Oh, caregiver burnout. Oh my gosh. Let's talk about that, right?
Right. So we've talked about the patient. Let's talk about the caregivers.
So caregivers often forget about themselves, point blank, period. Most of the time they're feeling guilty. They don't even want to leave the patient.
Right.
Or, they can't do it all, but they try to.
Right.
But you can't. They deal with being exhausted all the time. Mm-hmm. They're trying to manage home, manage their children, and working. Their own appointments outside of whomever they're taking care of, their appointments. So the stress buildup of it all can end up in a lack of sleep, which you need your sleep. You need rest to heal, right? We talked about this.
Right.
And so it's just a bunch of support systems that you would need to be a caregiver and not go through the burnout stage. But these are all things that can lead to burnout, and caregiver burnout is real.
Yes, I've actually seen caregivers completely lose themselves. So I think it's very important that although you are caring for a loved one, you should also, be in tune with yourself so that you're able to continue to give that care.
And that's why asking for help isn't weakness.
Absolutely. So this is my favorite part, segment 7, where we get to ask the nurse some questions.
Okay.
So let's see.
We got a couple questions
down here. So we got someone who says, how soon can I travel after surgery?
It all depends on your parameters that were set. When you came out of surgery, they normally, again, will write you up discharge paperwork, and it's going to write all those things that you should and should not be doing, and time frames, and who to follow up with. So with that being said, whatever your discharge instructions are, again, follow those discharge instructions. Your healthcare team is the best one to refer to for these types of things.
Understood. And we have another question. Looks like they're asking, what are some questions they should ask their surgeon before surgery?
Some questions to ask your surgeon before surgery. You want to make sure the surgeon knows what he's surgerying on.
Right.
If I could put it in that term, what are you surgerying on?
Right. And it's a real simple question.
Yeah.
But, again, I have an example. I was going in for surgery, and it was for my right side. Mm-hmm. And the surgeon, I took it as a joke because I was hoping he wasn't trying to go in for the left side.
Right,
It was
right.
the right side. But yeah, it was a big joke. He said, "So we're going in on the left side?"
Mm-hmm.
I said,
Absolutely
not.
not, sir. Sorry.
No.
Yeah, but it does happen. You can look this up. It's happened before. Surgeons go in and they chop off the wrong limb.
Yeah.
So you have to know. That's one of the questions I would ask. I would ask them, do you know what you operating on today?
Right. Right. And
Yeah.
the type of surgery.
Type
Yes.
of surgery, yeah.
Understood. So let's bring it. This brings us up to segment 8,
Okay.
where this is myth or fact. So
Okay.
I'm just going to ask a question, and you're going to say either it's a myth or a fact,
Okay.
or false. That'll work too.
Okay.
So nurses only work in hospitals.
That is a myth. That's false.
Okay. Recovery always takes the same amount of time.
That's also a myth. That's false. Everybody is different. Everybody is different.
Right. If you feel better today, should I stop taking my medication?
Now that is definitely a myth. Please do not stop taking your medications. If your doctor did not tell you to stop taking your medications, take your medications until they are completed or until your doctor takes you off.
Walking can actually help recovery.
Fact. When appropriate and according to the healthcare team's instruction, it can.
Planning ahead can make recovery smoother.
Oh, that's definitely a fact. Planning ahead can make everything smoother, not even just recovery.
Right.
Makes the whole process smoother.
Yes.
Yeah.
Agreed.
So that's definitely a fact.
So we're at segment 9. This is where we're going to have a little bit of fun.
Okay. A little rapid fire.
Yeah.
Okay.
And I'm going to ask you questions, and whatever comes to mind, I
Just
want you to
shoot
give the answer.
Okay. Let's go.
Your favorite comfort food after a long shift?
A banana nut muffin.
I know that's right. Now, with that banana nut muffin, would you take coffee or tea?
I'm going to do some coffee because I love the creamers. I love the creamer more than I love the coffee, but I got to say coffee.
Okay. Now, are you a morning person?
I am. I'm a morning person. I get up pretty early.
On the contrary, I'm a midday. And what is your favorite self-care activity?
Getting my nails done. My nails has always been my favorite activity for a long, long time now. Since I was a little girl, teenager.
Awesome. And one thing every family should know before surgery.
Okay, that's a good question. So some of the things that you should be looking for pre-surgery, the location is the main thing. You want to know where's the surgery happening on the body. If it's the left leg, you want to know for sure it's the left leg and where at, When a surgeon comes in the room, they'll always ask you, or they'll make a statement about what side or where we're doing the surgery at. Sometimes they'll even put an X on the spot that they're going to do the surgery. But it will behoove the person, whomever is having the surgery or whomever is assisting the person in the surgery, to know what is going to happen pre-surgery. Like if you're going to need anesthesia, if you'll need a driver after the fact. Post-op, are you going to need therapy? Are you going to need a specialty department? Any of those things you want to know ahead of time so that you can go ahead and plan for your recovery plan to be effective in the end of it all.
So the biggest lesson nursing has taught you, Tanika?
Patience. Much, much, much patience. I have more patience now than I ever had in my life.
I would say so, because you are dealing with all kind of people.
A lot of personalities,
yeah.
A lot of characters, a lot of, So,
yes.
I have to be able to tune in and tune out when I need to. And, so I would say patience.
I agree. Now, give me one word that would describe concierge star nursing.
Compassionate. We're compassionate over here. We care what happens to everyone. We care, especially when you're in our care. Everyone's a star.
Absolutely.
So if there's one thing I want listeners to remember, it's this. Recovery doesn't happen overnight, fam. It takes, what's that word? Patience. Yes, it do, my friends. So don't forget that. And it takes preparation. And it takes support. And knowing when to ask for help.
And don't think that no time is the right time to ask for help.
Right.
Ask at any time.
Anytime. How you say, defeat that burnout.
Right. If it causes a question mark, ask.
Ask.
Because again, we all have our roles that we play.
Yes, we do.
So, and we do hope that today's conversation reminded you that you don't have to navigate recovery alone.
And if today's episode helped you, share it with someone who may be preparing for surgery or caring for a loved one. And remember, visit us at conciergestarnursing.com to learn more about our services and explore the Concierge Star Nursing Academy.
So until next
time, care with heart, lead with purpose.
When you need a caring hand, we're here to help, we understand. From home to healing, near or far, you're in great hands with Concierge Star. Concierge Star Nursing care that shines so bright. Professional, compassionate day and through the night. Health, comfort, peace of mind, we're with you every day. Concierge Star Nursing,